Hello and welcome to Westwind, an audio podcast about cancer, technology in medicine, and policy issues. I'm host and medical oncologist Dr. Jack West from the City of Hope Comprehensive Cancer Center in the Los Angeles area. You can find Westwind material at beaconmedic1word.com, at iTunes, or just about anywhere you get podcast content. I would just ask that you show your interest and support by subscribing, commenting, sharing by telling friends and colleagues in person and on social media, and rating it however you feel is appropriate. You can also share your ideas and opinions by emailing us at westwindpodcast@gmail.com. I'm very happy to be joined today by Dr. Jerad Gardner, who is an associate professor in the Department of Pathology and also associate professor of the Department of Dermatology, a dual appointment, and the program director for Dermatopathology Fellowship, all at the University of Arkansas for Medical Sciences. He's also a prolific leader on a global level in the whole field of social media and online education in pathology. So thanks, Jerad, for joining me today. It's great to actually talk to you after following you online for so long.
Thank you, Jack. It's a real honor to be here.
So this is our first chance to speak directly. Can I just start with where you're from and whether it's a big or small family and whether you knew from a very early age that you were going to be interested in medicine?
Sure. I'm the oldest of 5 kids. I grew up in rural central Ohio. And then when I was a teenager, my family moved to Northwest Florida near Pensacola. And then I've kind of moved all over the South for training. And then I married. And so I'll probably be in the South for the rest of my life now. And I like it down here a lot, actually. And after my training, I came to Arkansas for my job, and I've been here for the past 7 years. So this is the only job I've had. When I was a kid, I was always interested in science. I was a very nerdy child, I guess. And so I think I talked about being a doctor or all sorts of different science-related things when I was young. And then when I was a teenager, I guess I kind of thought, oh, I'm too cool for all that. But obviously that wasn't true. And I did some tests when I started college, and they said, oh, you're good at math and science. And I said, yeah, of course. And, no surprise, that's what I like doing. And so I kind of gave in and decided that, medicine probably was a good choice. And I started, a friend of mine actually worked at a pathology lab, and her mom was the lab manager, a histotechnologist. And so she said, oh, I got a new job at my mom's lab, and you should apply. There's another position for a technical assistant. So I went, and it's a Pensacola pathologist in Pensacola, Florida. So I went and applied and started working there, which is really cemented my desire to go into medicine and really got me very interested in the field of pathology. So I think that was a very fortuitous thing that I got that job. And that really, I think, opened the door for me, not just to go into medicine, but it made me, really decide I want to be a pathologist. And then once I took histology and some pathology related rotations in med school, it was a done deal. I knew this is what I had to do.
That's great. And, it also seems that, at least from an outsider's perspective, but I think in general, that pathology is one of the fields that is one of the more lifestyle compatible, lifestyle sparing. You said you're married. I don't know if you have kids, but is that a factor that was a consideration back when you were choosing a specialty, or did it just fortunately turn out that way?
Well, it's a little bit of both, I guess. I was afraid, in medical school. I thought, I don't know if I could be a surgeon or do something where you have to work all day and all night. And I actually really liked surgery, it turns out. I thought it was a really great rotation. But I think that why I chose most of all to be a pathologist is I just realized I loved it so much. I loved looking in the microscope and solving cases. And there was nothing else I did in med school. I actually liked most of my rotations in 3rd and 4th year, but nothing else I did came close to being as exciting as diagnosing things microscopically. So it turned out, though, it was a beneficial thing that it just so happens pathology is kind of suited to a good lifestyle. I work quite a bit, actually, but my work is flexible, which is really nice. I do have a wife and 3 kids. My wife is actually a child psychiatrist, and she's in private practice. So she has a clinic and patients that are there waiting for her at the clinic. I have patients too, but they're sitting in a tray on my desk, each of them being a biopsy, right? That represents a patient who's waiting on a diagnosis. So I need to take the same level of, care with those cases and make sure that I get the results out as fast as I safely can. But if I need to go take my kid to the doctor in the middle of the day, I can come in really early the next morning to get my cases done or come back at night. So that flexibility is really nice for lifestyle for sure. So it kind of worked out nicely that pathology has that kind of flexibility that a lot of other fields of medicine don't.
Now, my perception is also that pathology has really changed over the last 10, 15 years, and that so much of what we do, at least in cancer, is now driven by molecular diagnosis. And so the whole field of molecular pathology has exploded. How much or how little has that changed the field of pathology overall? Is it still closer to the way things were practiced 10 or 15 years ago, or is it an ever evolving field that's dramatically different every 10 years now?
I think the basic core of what most of us do in pathology, and obviously pathology is a huge field with lots of different facets. There's anatomic pathology, which is I'm trained in anatomic and clinical pathology, but in my practice now, I do purely anatomic pathology and am just focused on skin pathology and bone and soft tissue sarcoma pathology. Really, that's the main things that I do. But yeah, I would say that for the anatomic part of pathology, at least the part that I'm the most familiar with, the core of what we do still involves taking tissue biopsies, processing them and making them into microscopic slides, looking at those and looking at the microscopic features and putting that together with the clinical information and making a diagnosis. So I think that core is still the same, but obviously as ancillary testing like molecular analysis, for example, as that has evolved really rapidly, that's really changed a lot of the stuff we add on top of the basics, the foundation. And it gives us the ability to diagnose at a higher level, to solve diagnostic problems that in the past we couldn't, things that look a lot alike and that there was no way to tell apart. Sometimes now we know, oh, this translocation is found in this tumor, but not in that one. So we can sort that out. And like you said, there's a lot of companion diagnostic testing that's coming up that we do a test. And when that's positive, then the oncologist can give a certain drug that goes along with that finding. So I think that we're doing more things than we did in the past, but I think a lot of the basic stuff actually is still kind of the same.
Okay. So you're very well known online for your social media presence, but did this come about while you were already a pathologist and trying to get information, get education out there, or were you already online and just adapting to whatever you were doing in your life? And when that was pathology, that got incorporated into your social media activity?
I actually started, I think, my Facebook account, I want to say it was like January 2007, something like that. I think my cousin invited me to join. And at that point, I was a first-year pathology resident, I think. So yeah, I didn't really have any social media presence prior to being not only in medicine, but actually in pathology. And I started it obviously for friends and family, but when I went to meetings, I'd meet other residents and I'd add them as friends on Facebook. And I found it was a great way to kind of keep up with them. And, the next time you see them, you've got stuff in common, stuff to talk about because of what you've discussed online or posted online. And I found instead of saying, oh, what was your name again? You actually already knew these people. They were kind of like your friends already. And so that was really helpful. And pretty soon I ended up having probably more people that were doctors or pathologists, particularly, than I had regular friends and family who weren't doctors. So I realized, well, there's probably a real, a usefulness of using social media for medical related things. And I was really interested in education, and I kind of dabbled in, I started Twitter not too long after that, didn't really understand why it was valuable. Like many people, when they start, they think this is kind of silly. No one will ever like this. And I was clearly wrong about that, I guess. And then later, I guess, fast forward a few years, when I started practice, I wanted to do something to teach about pathology online. And I thought about starting a website, but that seemed really complicated. I didn't really know much about coding, and I didn't know how to get hosting and all that stuff. So I thought, well, I'll start a Facebook group. And I started 2 Facebook groups in 2013 focused on derm path and bone and soft tissue pathology. And I thought I'd invite maybe, 100 of my friends or colleagues. And instead, thousands of people from all over the world joined in like a few months and started posting their own cases and sharing links to literature. And it just exploded. And I gave a couple talks right around that time at national meetings that were supposed to just be small talks. And they basically sold out, or had, people overflowing out of the room wanting to hear about social media and pathology. So right around then, I decided, well, I should put all my eggs into this basket. Clearly, this is what the people want. And that's worked out pretty well for me so far.
Absolutely. Is there something unique about pathology that it makes it so amenable to sharing and interactivity on social media? I mean, obviously it's a visual medium, but is it that there is some portability to it? There's your role in it is circumscribed. It's not a huge clinical history or anything like that very often. Or am I just misperceiving and maybe that, every field could be like pathology? I would just say that you and the whole pathology community are the exemplar. I mean, the envy of just about every other oncology or various other physician groups that just don't seem to have as much of a cohesive presence, even when we are interactive and friendly online.
I'm going to take that quote and put that right in my CV. Say, Jack West said that pathologists are conquering social media. I'm just kidding.
Yeah.
But I think it's a mixture of things. There's a great book by Malcolm Gladwell called Outliers. I love all the stuff Malcolm Gladwell writes. He's just such a great author and tells great stories that are very relevant. But I really like Outliers because it talks a lot about why do some people end up doing things so far beyond all their peers. And I think a lot of it is that he goes into in the book is there's a big part of being in the right place at the right time. I think that partly is what happened with pathology. I think if I would have started aggressively using social media earlier, there wouldn't be enough pathologists online, and I would have given up because it would have just kind of been dead space. I'd put stuff out there, there'd be no interaction. So I think I kind of started doing it just at the right time that there were enough people to kind of form a critical mass, and then it's exploded from there. So I think there's part of that. I think you're totally right. As a visual field with very, microscopic images are quite beautiful, even of terrible diseases. They're really, even to the lay eye, to non-medical people, they often look, pretty or interesting. So it's real easy to share those things and to share information anonymously in a de-identified fashion and to share educational content that way. So I think that makes it easy for us to use it. But I do think there's some aspect of also this kind of sense of community. In our field, there's a real tight-knit group of people, and that group has continued to expand. And I think, to me, that's what keeps people coming back, is that they get plugged in, they start tweeting or start posting in Facebook groups, and they get to know other pathologists from all over the world who become not only colleagues, but really close friends. And then when you meet these people in real life, it feels like you've known them forever, like they're some of your closest friends or even family. And I think that sense of community and family kind of feeling is what brings people and keeps them active, because that's an exciting thing. That relationship bond is a really important thing that keeps people engaged and involved. And I think too that part of why we've been able to develop that in pathology is because our field is very different than most other fields in medicine and has some unique, I don't know if issues is the right word, but we have some unique things that are maybe pros and cons. We work behind the scenes, so most patients have never even heard of us, or if they have, they think we just do forensic autopsies, which is one part of pathology, but obviously most of us are spending most of our day diagnosing live people. So there's a lot of misconceptions among the public about what we do. And then even in medicine, a lot of other doctors don't really have a good sense of what we do as pathologists. So I think the kind of need for camaraderie and understanding that we all kind of face the same issues and that we have the same struggles, I think that is part of what draws us together. We're also a small field compared to many other fields. There are not that many of us. And even before social media, if you go to meetings enough, pretty soon you start to meet people, or someone who knows someone who trained you. And it's just really a small world, honestly, in pathology. So I think that those things have enhanced that ability to kind of build this really tight-knit community. And social media has just made it go even further and brought it to the next level. So I think all of that kind of combined is part of what's made pathology social media so successful.
You mentioned that you started on Facebook, you have a presence on Twitter, and I would imagine that there are other platforms like Figure One, for instance, that are so visual. I know you also put out content on YouTube. Are you putting out content with an expectation that you need to put it on different platforms because different people are just living on different platforms? I think it's a younger crowd on Instagram than Twitter or Facebook these days, but are you envisioning that you can bring people to try other platforms, or that you need to create content for various platforms to reach largely non-overlapping audiences?
The latter is the most significant point, I'd say. I think when I started social media, I started with Facebook. I started using Twitter after that. And then I realized that, there are different groups that use both of these platforms. Some people use both, but some people say, I only use Twitter, not Facebook, or vice versa. So I thought by broadcasting the same content on multiple platforms, I'll have a better chance of reaching as many people as possible. And, when I give lectures about this, sometimes people say, well, why does it matter how many views or how many retweets you get? And it's not just about the numbers or the metrics, although those things are helpful to impress kind of the naysayers who say, well, this social media stuff isn't powerful. And then you show them these huge numbers of how many people you've reached with your posts or your tweets. So that's helpful. But much more importantly is if I'm sharing this content with the sake of educating other doctors, the goal being that hopefully that will help them make a better diagnosis in real life and help one of their own patients, then why not try to get it as broadly sent out as possible? Just again, in the hope that one person somewhere on earth will benefit from it. So that's what I started doing, is expanding out to different platforms. Over time, I realized, like you said, that there are different audiences on different platforms. I post pretty much the same content on Facebook and Twitter. On Instagram, I kind of post less often, and I tend to post things that are a little bit more interesting to not just pathologists, but to a more general audience. Like you said, a lot of my followers, I think, are probably younger. I have many non-physician followers, either people that are just members of the public that are interested in medicine or maybe in other fields. And so they may not want to know nitty-gritty details about microscopic diagnosis of rare tumors, but they are interested in how do pathologists do what they do behind the scenes. What's a tumor look like when you cut it open or whatever. So I think there's kind of different content there. YouTube obviously is a wide audience. And what I like about YouTube is that you can put videos there for very junior beginner level learners and also really high level people that really need esoteric detail and everything in between. So I like YouTube because it allows me to make, I can make a video about low-grade fibromyxoid sarcoma explained in 5 minutes. So here's the package deal for a resident who needs to get the question right on the test. But I can also make a long video explaining all the nuance for people who are in practice trying to make the diagnosis and who want to get, 10 examples of what this looks like. So I love that I can kind of teach to different levels with YouTube. And I've also realized that as I give a lot of talks about this, I've given, I think, getting close to 80 lectures just about social media. It's almost 50% of the invited lectures I've given her about social media now. So I'm supposed to be kind of an expert in this area. So now I kind of experiment with new platforms for the sake of learning about them and knowing about them. So I've tried out Snapchat, and I find it kind of challenging, and I realized that I was old when I tried that because I couldn't figure it out. It's meant for digital natives, people who have grown up with touch screens and digital devices. And I'm relatively young, but I'm a digital immigrant. I heard this term somewhere, digital native versus digital immigrant, and I love it. I think it explains perfectly the difference that I had to learn how to do all this stuff as an adult, a young adult, but still I was an adult. I went to a library as a kid to get information. I didn't use Google. There was no Google. So I think that that as the audience changes and as we have new generations coming into medicine, we're going to have to experiment with different platforms and learn to teach in different ways if we want to be as effective as possible as medical educators. So that means I need to get out of my comfort zone sometimes and try different stuff. I've also tried Weibo, which is like the Chinese government approved social media site, because pathologists in China, there are many of them, but they can't get easy access to Twitter, Facebook. So all this content that I'm putting out there is basically very difficult to get for all of these pathologists in China. But I tried Weibo, and half of it, even the English version, is still in Chinese, and I couldn't really figure out what I was, clicking OK to. So and also no one seemed interested in what I posted, so I kind of gave up. But I like to try, different platforms and see what's out there and be aware of kind of what's coming down the pipeline in the future.
Yeah, I think it's an interesting balance. You want to explore different platforms that may have different strengths, but at the same time, we also need to be mindful of where the audience is. And at least in a large part of what I do, the physician audience is largely on Twitter. And Facebook, I think, is a pretty diverse, largely patient-oriented audience. Obviously, there's physicians there too. But do you find that certain platforms are better for the interactive portion? Because I know that you have said Sanjay Mukhopadhyay was a prior guest who paid homage to your nudge for him into social media, and he obviously took it far. But, he mentioned that you had said, well, my videos teach while I'm asleep, which is great, but part of it is pushing the content, which is, totally scalable. And then part is the interactive component that I think we thrive on, but I think is more feasible in some platforms than others. So what are your thoughts on the strengths or weaknesses of different platforms for the interactive component?
That's a great question. I think it does vary quite a bit. Obviously, like you said, Twitter is, at least for me, a very largely professional audience, many doctors that are there. Also some patients, patient advocates, of course, there's a large component of that. But yeah, I think that Twitter, though, is for sure very fast, very interactive, as you well know. I think Facebook also is that way, but particularly if you're in Facebook groups. I think that regular Facebook accounts, people usually like to have friends and family. They may have some colleagues on there, but they don't usually do a lot of nonstop talking about pathology or whatever, medical related things. So I think in Facebook, I do something a little different. I have a Facebook professional page, which I know Sanjay spoke about when you interviewed him, that this is basically a way that you can have a public page that's viewable to anyone on the internet. And it's run from your personal Facebook account, but your personal account is kind of behind a privacy wall. So no one can see unless you friend them, the pics you put up of your kids and what you had for dinner last night or whatever, but they just see the medical content. I also think it's helpful because I post some graphic images that are not necessarily of interest to some of my friends and family. They just want to see pictures of my cute daughters or, where I've been traveling or something lately. And so this helps me to put my medical stuff in one place, and friends and family who want to see worms and, weird things like that, they can follow or like my page. And those who would rather not see those things cannot follow my page, and then they'll be kind of sheltered from it. So that's one thing I do. And I basically post on my Facebook page the same kind of stuff that I post on Twitter. And I agree with you. I think I actually get more views of stuff I post on Facebook. And that's just, I think, largely because there are so many more people on Facebook than on Twitter. I think last time I checked, like over 2 billion active monthly users, if I'm correct. And I think Twitter was somewhere around the 400,000 to 500,000 mark. I might be off on that. But anyway, it's like multiple levels of difference. And I think, though, that I get a lot more reach on Facebook when I put stuff on my professional Facebook page, but I get a lot more interaction usually on my tweets. But the one other aspect of Facebook that's really special that Twitter really doesn't have anything like this is the ability to have groups. And you can have groups that are private or secret. So I'm in pathology related groups, those ones that I started, and also some additional groups that have popped up since. And in those places, people, even if they're not friends with each other, they can post content or cases, and then you can have ongoing discussions about those things. And those groups are very interactive. Phillip Mckee is a really famous dermatopathologist, and he got famous the old-fashioned way. He wrote basically the Bible of derm path, one of the major derm path books that we use as a reference in practice. I still use his book almost daily. And he joined Twitter and Facebook couple years ago, and he started a Facebook group, and he's retired now, and he worked at Harvard for much of his career and a few other institutions. He's retired and lives in a small town in France now, and every day he checks on the Facebook group and he'll make comments, teach, give unofficial thoughts or opinions about cases, helping pathologists all over the world, and that group is incredibly interactive, and it's really, I think, largely because he devotes so much time and energy to it. And there's also Facebook groups that are run by patients that are patient support groups. And I volunteer in a handful of those. And that's been an amazing, life-changing experience for me, getting to work with patients with sarcomas and getting to teach them some things about their disease, but more importantly, to learn from them about what it means to go through the process of having a rare cancer. So those are the kind of differences between those two.
We'll continue our discussion with Dr. Jared Gardner in our next episode. Thanks for listening. The West Wind Podcast is a Beacon Medical Interchange production with sound engineering and distribution by Mark Lindsay of Talking Speaker. We hope you'll be motivated to subscribe, whether at beaconmedic.com, through iTunes, or through another podcast service. Please also rate it, and I hope you'll be inclined to tell friends and colleagues in real life and on social media. We're always happy to get your suggestions and other input at westwindpodcast@gmail.com. Talk to you again soon.